Hi, James Natzis from Apricot Consulting. We're in a really interesting time in the history of the world, and in health, we are facing some fundamental challenges. COVID has certainly put the health system under a significant amount of strain, not to mention those in elective surgery and the backlog that has created moving forward. What we're seeing in our research is that doctors, nurses, allied health professionals are significantly impacted by COVID. And this notion of resilience and this ability to be able to steadfast in this season has put many under significant stress. Black Dog Institute says that 35% or more people are undergoing significant anxiety. The truth is that if you're a medical professional, you're also in that. Not to mention that you may have been impacted by COVID yourself, or a colleague has as well. The good news is that we've been working in the health space for some time now, and we've also built a resilience program for health. When we define resilience, we look at a number of areas. In fact, we look at 4 key areas. Obviously, the mental or the intellectual component, and there's much written about that in the market, and we look at that. We also look at the social dimension of that is relationships, partnerships, and so forth. Then, of course, there's a physical component of that, which is looking at how you take care of your body. And then, of course, the final one's spiritual. When we define spiritual, we look at purpose, the get out of bed factor, those elements that make what you do successful in the longer term. If your team in health is undergoing some challenge right now, or perhaps needs some support, we can design a resilience program for you from end to end, including some of our partners around the diagnostics of that, doing a baseline on that through some really good journal research, and then of course designing some training programs, workshops, coaching, etc. to support your workforce through this very, very difficult time.